Northwest Indiana. News, sports, education, and entertainment. Wake Up GI with Jeffrey Smith. Brought to you by the Geary Community Schools Corporation.
All right, everybody, we're back about 28 minutes after the hour right now. It's a wonderful Tuesday. It really is. It, of course, is the 20th of September, 2022, and this is Wake Up GI with Jeffrey Smith. We got a friend of ours that is back in studio. We've had this young lady on, it might have been a month ago or so, talking about the event that you heard me kind of muse over today in the Morning Muses. It's going to take place Saturday, September 24th at beautiful Marquette Park Beach. It, of course, is the Breast Cancer Awareness Walk that is always sponsored by Community HealthNet and Dr. Janet Seabrook. On-site registration begins at 9 o'clock a.m., ladies and gentlemen. And, of course, the walk itself starts at 10, as we talked about in the Morning Muses earlier. And I'm going to definitely go over to Leslie because, you know, I can get emotional and triggered about this, but it's just $30. As far as the donation, and I very much appreciate, and so many of us appreciate the work that these organizations do, in which they go out here and they really connect to the community, and they go out here and help raise those dollars that are needed for families, as well as the survivors and the warriors themselves who have to go through cancer, and the support group that has to go through it with them. And as I've described a couple personal instances that I saw, it was transportation was being provided, lodging was being provided if you have to go to some of the major hospitals across the country. It starts at the nexus of the organization starts at places like this, or at events like this, like these breast cancer walks. And this is a very, very wonderful event. And I'm so happy and pleased to have Miss Leslie Delgado in studio to talk about the wonderful organization that she is a very big part of, that it goes out here and puts on a top-notch production. So with that being said, happy Tuesday, Leslie. Welcome to the show.
Hi.
Let me make sure your mic's on. That's how this works. Go ahead.
Okay. Hello, good morning. Thank you so much for inviting me again to be here. I'm so happy to be here with you.
Yeah.
And share again a little bit more information about who we are and what we offer to the community,
Yes.
and how we engage with the community as well. Community HealthNet Health Centers are non-for-profit, federal qualified health centers committed to provide quality, accessible, and affordable health care for our community. Some of our primary services are behavioral health, dental care, eye care, family medicine, pediatrics, OBGYN, vision, hair screenings, assessment, but we also offer a lot of additional services.
Yeah.
Yes, some of those are the cancer screenings, like the breast cancer.
Yes.
Center in parenting, center in pregnancy, confidential HIV testing, insurance enrollment services totally free for anybody in the community, senior SNAP enrollment services for the seniors. We have support groups, we have telehealth visits as well,
Yeah.
and a lot of different other programs the Community HealthNet offers to the community.
Yeah.
We have 7 locations in Lake County. We have 2 mobile units, 1 dental unit and 1 medical unit. We
Yes.
also have, just like you mentioned, the transportation unit that
Yes.
is available for our patients.
Yeah, I mean, number one, you all keep getting bigger. I don't think people really appreciate, and sometimes I forget until I see that darn mobile bus all over the community. But you all are big. I mean, 7 locations throughout the region, and then, as I said, those mobile vehicles are absolutely essential for healthcare screening. And as you were kind of reading off the list of services that you provide, I really have to give you all credit for really filling a void. I mean, you know, I'm sure you know it firsthand more than many of us know, as well as Dr. Seabrook, is that, you know, when the pandemic hit, everything got exacerbated. Everything got exposed. I mean, you know, I've talked about it with various people in different industries. We talked about the food desert. I talk about so many different things. But one of the things that really got exposed was lack of health care, or proper adequate health care for certain communities. And to see that you all are literally covering across the board, and then in addition to that, you're providing people with navigation services to get health care.
Yeah,
So,
yeah.
I mean, is it one-stop shopping basically over at Community HealthNet? Go ahead, tell me a little bit about that.
Definitely, Community HealthNet tries to have everything in one place, so whoever comes in the doors, they can be served at whatever areas they need in their life. We have community health workers that can even help them. Some that are in need
Right.
of a home,
Yeah.
they help them. Some that are in need of some food, they refer them to food pantries. We also provide some food boxes in the clinic, so
Right.
we try to have everything on one side, so the patient receive most of the care in our centers.
Now let me ask you this, and maybe you can speak to this, and I'm not being misogynistic or anything, but speak to it as a woman, because I've learned so much by running and coming into contact with young people as of late. And as once again, I get back and I listen to kind of when you were reading the list of services. And so I want to ask you about the extremes. One of that is, obviously the first one is seniors and providing adequate care and information services. Sometimes you might want to send them to a specialty, a genealogist, or whatever kind of doctor that they might need. But how do you reach out, or how can seniors reach out to you? And then this is something that I was referencing when I was talking about the young people. It is unfortunate, but there are a lot of young mothers and young families that are just getting started that sometimes, and I didn't really, I guess I took it for granted that it's easy, but there are a lot of young mothers and sometimes young fathers, young families that really don't understand the adequate care that's needed in the developmental years of having a child. Do you all provide some kind of outreach or some kind of resource for those kind of families?
Definitely. Community HealthNet has, like I said, support groups. And one of those support groups is the Centering Parenting.
Yes.
So, and we have the Centering Pregnancy once the baby are in the womb, and then the Centering Parenting. So they bring parents together, especially the young ones that is the first baby, and they learn how to take care of that baby.
Right.
And they also talk about the services that are available for them as a parent, and the importance for them to take care of their health first, before they can take care of the baby. Yes.
This is something, I guess, I figure you've been around, Janet, or you've been in the business a long time. But once again, I'm asking, about these, because these are certain conversations that I've overheard, and I'm hoping the audience can be a little informed as I ask these questions. As we talk about, the new parent or the mother and things like that. Do you also do you have resources that deal with the mental health of the mother? Because I was watching a program, and I think, obviously as a guy, I don't think a lot of us, unless maybe you're dealing with it with your wife, but I think a lot of times we are unaware that it is such an emotional burden that a woman goes through when giving birth. And sometimes when they come out on the other side of it, even though the baby's healthy and ready to go, the mom is a little bit taxed and maybe needs to kind of somehow talk to somebody or be brought back up. So do you all provide those resources?
Yes, definitely. Again, through the Centering Parenting or Pregnancy group, they talk to the nurse there, and there are a lot of resources available for them. But Community HealthNet, we try to do any referrals between the services that we have, but if we don't have those services, then we refer out to other specialists. But Community HealthNet offers behavioral health services.
Yes.
We have behavioral health services at all of our locations, so if anyone needs to talk to somebody, they are available to talk to them.
Absolutely. And so, as we kind of, we'll go back and obviously talk about this a bit, but I just really love to delve into, because I think healthcare is arguably one of the most important issues that we face in this country, and it affects everybody at, no matter what level you are. You might not think you're sick, but you really do need to be cognizant of your health care. And so I can appreciate all the things and the services that you all provide. Let me ask you this, obviously over the weekend, the president was on, and, we all have kind of taken this attitude that maybe the pandemic is over. And the federal government has kind of stopped with the mandatory COVID testing and all that kind of thing. What is Community HealthNet doing? Because obviously, and, as a lot of people want to constantly let people know, the COVID-19 virus is still out there, and it's still affecting people. And sometimes, when the federal government kind of pulls back, then the resources kind of dry up as far as being free. And now you got to go out here and kind of find some way to pay for these things. Tell me about you all's status if people are still concerned about COVID.
You know what, some of our patients are, and Community HealthNet deals with the same procedures. Everybody's using the face mask within the center. And we also providing free home COVID tests to our patients. And every time we go to the community, we are continuing to provide this COVID test to the community, and we are educating them that they still need to take care of them.
Right.
Try to not be.
So you all are still providing free COVID tests, okay? Because that's that's one of the things that I do know people are concerned about. In particular, when you're hearing people from the government, the federal government, start to say, "Hey, well, COVID's over. We're not really making those or purchasing those tests anymore," and so Then now when people get a little bit sick or get the extended sniffles and they're wondering, like I need to go get a test, but I don't know where to go because the clinics are closed up. And you're saying that you all are still providing that service?
Definitely. All they have to do is give us a call, and they can come to one of our 7 locations, and we have tests available that are totally free for them.
Yeah.
They can give us a call at 219-880-1190, and they can receive some tests.
Now, let me ask you this. I'm just kind of thinking about most districts, the Gary Community Schools, and maybe a couple of others, are really about 5 or 6 weeks into the school year right now. But it still doesn't erase the fact that there's a lot of making up ground to do because of the pandemic. And one of the things we found out was that parents have some parents, and it's through no fault of their own most of the times, have kind of lost track of their students' immunization records. They kind of got behind on the shots and things like that. What kind of services do you provide, and what would you say to those parents out there that are still trying to chase and catch up and make sure that their scholars are immunized properly?
Definitely. You know what? Community HealthNet is very aware of that situation.
Yes.
So Community HealthNet has planned some vaccination clinics for the kids. So coming up this week, throughout this month, we're going to have some vaccination clinics for the children.
Nice.
I don't have the exact date.
That's all right. You can shoot it to me.
Yes, but all they have to do is give me a call back.
Yeah.
219-880-1190 to get more information about those exact dates.
Yeah.
And they can bring their children, and it's going to be open to anybody. They don't need to have an appointment.
Right.
So anybody can walk in, and all those students will get their vaccines.
Now this is kind of interesting because the couple of times that you've been here, and then also just kind of working and knowing Dr. Seabrook in the past. I'm going to ask her one day how you all actually make money, because you all do so much stuff that you really kind of go into the community and really provide services for free or little or no cost. But, if there are people out here that are listening and they have not connected to a personal doctor or a health clinic, what do they need to have? Because are you an insurance-driven organization? I mean, exactly can people literally just walk into Community HealthNet and start to begin their procedures of getting services provided?
All they have to do is give us a call or walk into one of our health centers.
Yeah.
And again, we have 7. We got one at 1021 West 5th Avenue in Gary. We got another one at 3503 Martin Luther King Drive in Gary.
Right around the corner.
Definitely. And we also have one at 1015 North Shelby in Gary, Indiana as well. 3900 Calhoun, so inside the high school.
Yes.
We also have one at 5926 Calumet Avenue. This is inside the high school.
Yes.
And also we have 5927 Columbia Avenue in Hammond. And we also have one in Maryville on 6100 Broadway, Maryville, Indiana. They can come in, walk in at any of our sites, or give us a call to schedule an appointment. You all are
like, I was thinking about this a while ago, you all are like the old school Radio Shack. Remember Radio Shack, that store? There's one like on every other corner. I mean, for real, because every time I drive around, there's a Community HealthNet there. Now, is the one in Miller, that's where, does Dr. Simpson work there?
Yes.
Okay, because I thought so. That's my guy. So I want to give a shout out to him. But, as I said before, you all are absolutely doing a lot of good work. I'm sure it is very rewarding. I know people utilize your services. Now, let me ask you this. Out of the 7 locations, because you basically named when you were talking earlier that, all the services that you named are provided at all 7 locations. Or do some locations differ with certain things? Tell us about that.
Yes,
and then we're going to the phones, by the way.
Definitely, yes. The eye care and dental care, we provide those services at our main location at 1021 West 5th Avenue, Gary, Indiana. And at the dental services and at 3503 Martin Luther King Drive. So we have the dental services at both of those locations.
Yes.
When it comes to the eye care services, those services are at our 3503 Martin Luther King Drive, as well as the 3900 Calhoun, the eye services.
Now, what's provided at the one in Hammond on Columbia? What do you all do there?
They have family medicine.
Okay.
They also have pediatrics, OB/GYN, behavioral health services.
They got an OB/GYN over there?
Yes, they do.
Oh my God, you all are doing everything. Do hospitals sometimes ride by and throw bricks in you all's windows? I mean, really. I'll tell you what, I want you to put the headphones on. I think we got a phone call for you today. We're talking with Miss Leslie Delgado. Of course, she's always a great representative of Community HealthNet. Caller, how you doing? I'm doing great. Yes. We appreciate you very much, and that was a wonderful call. Yeah, I mean, it's got to be satisfying to hear people kind of refer. I mean, that I was making a joke, but I'll be honest with you. The fact that you all are so convenient, and you're not, an arm's throw where a person has to kind of make that business decision about how they're going to get to you or if they're going to get to you when it comes to their health care. Yeah. So I think it's absolutely amazing. Go ahead once again. Tell us about the event coming up Saturday.
Yes. So the event that is coming up, it is our annual breast cancer 5K walk for this 2022 year.
Yeah.
And I would like to talk a little bit more about this event.
Please.
This will be virtual and in person.
Okay. Now explain that. You know who you're talking to.
So this will be on Saturday, just like you mentioned, Saturday, September 24th, 2022. Community HealthNet Health Centers will be hosting the 2022 Breast Cancer Awareness 5K Walk. The Breast Cancer Awareness 5K Walk is sure to provide a day of inspiration, fun, and entertainment. In addition, the community fundraising efforts will enable Community HealthNet to strengthen our programs and services in the fight against the breast cancer. We are on our way to raising $20,000. That's our goal. While also increasing the breast cancer awareness, and guess what? You all can help it.
Yes, yes.
So let me share a little bit about the event. Again, it will be in person at Market Park in Gary, Indiana. On-site registration will start at 9 a.m. and the walk starts at 10 a.m. The virtual, it will be via Facebook. So if you visited fb.com/CHNBCA5KW,
right,
it will be the virtual walk and it will start at 10 a.m.
Now, what's the virtual walk look like? I know we're living in the metaverse now. You got to still explain it to me. What's the virtual walk look like?
Okay, so you will be going along with the people that's actually walking.
Oh, okay.
And if you have a treadmill, you can.
Oh, okay. I get what you're saying.
You can do it yourself.
Okay. All right.
From home.
Still pay your $30, people. Don't use that to cheat. I'm just like, we got some shady people out there. No, but go ahead, please.
Yes, some of the activities we also will have the best dressed person, the best dressed team.
Oh, so we're doing that now.
Yes,
now it's the best dressed. Okay, all right.
And this event is for families, adults, athletes, anybody in the community that will like to come out and join us. We will have a lot of giveaways.
Yeah.
We'll have music, food, some beverages. And some of our fundraising programs is that it gives you access to a personal fundraising website that you can customize yourself.
Yes.
Personalize and share with your friends and your family. Let them know that what you're doing for the community.
Yeah.
Also, you will receive a lot of fundraising advice and support. No fundraising minimum, so there's no minimum.
Okay.
If you want to donate $1, please.
Okay.
As much as you can.
Yes.
Okay. Any donation, it works.
Yes.
The walk, the day support, and changing the lives of those with breast cancer and their families. All these are our fundraising programs. What it will benefit you and your family and the community as well. So what we're waiting for, register now, come out and join us. It will be an amazing day. And so many ways that you can participate. Again, you can register and walk with us on our website at www.chn-indiana.org.
Yeah.
Or by clicking, or by giving us a call at 219-880-1190, and they can also provide more information. You can register in paper if you would like to do in paper, and not on the website. You can create your team, or you can donate to an existing team already.
Okay.
You can create or donate to a fundraiser. You can become a volunteer.
Yeah.
Or you can also sell merchandise as a vendor at the event. So all these are different ways how you can participate. If you have any questions, again, give us a call to 219-880-1190. You can email us at chnoutreach@chn-indiana.org. And please don't forget to follow us on our social media platforms, Facebook, LinkedIn, Twitter, and YouTube.
All right, now, there are a couple of things I want to bring up, and then I'll make a revelation to you, Leslie. I'm sorry you're going to have to hear this, but first I heard the word teams, and I've been out there to, a number of these events. First of all, as I said previously, this is a wonderful event. And I definitely will always and encourage everybody to support it. But now I got to get into some nitty gritty because I hear the word teams, and so I want to ask you this year. I don't, sometimes I get a little confused. Are there prizes for people coming in first place or anything like that?
Well, they have, like I said, a lot of giveaways.
Okay, because
they have a lot of big giveaways, raffles.
Yeah, but is it a competition? Because at times it gets a little confusing, and this is where I'll make my personal revelation. All right, and I don't mind, and I know don't look ill on me as I tell you this story. Okay, but in the past couple of years, there have been a couple of kids that have been participating. A couple of young people. I don't want to call them kids. They've been participating in this. Now I get it confused. Sometimes I think it's a race. Sometimes I think it. Either way it goes. Full disclosure, I live around the corner. So what I kind of do is I cut through and I jump on the other side, and then I come through the finish line first, and I'm looking for some kind of prizes or medal, but I never get anything. And so I'm trying to find out exactly, is this a race or not? Because
no, it's not.
Okay, good, because
No, it's not.
because some people accuse me of being a rabid cheater, and I just think that I'm trying to play to win. So I take this very seriously, by the way, in case you didn't know.
No, this breast cancer walk is for people to come out and support.
Okay.
You don't have to worry about, I need to be walking so fast.
Yeah.
No,
Okay.
it's not about winning.
So you don't.
No.
So if I go out here and I push people to the side and knock them down, that's frowned upon. Okay, all right. I got to get the rules straight before I get out there and start participating. But also, tell me how this best dressed thing works. Like, should I come in a suit and tie, or is this my best workout gear? How's that working?
No, the best dress is do tutu and
Oh, okay. My little workout gear.
Everything
All right.
related to the breast cancer, yes.
Oh.
To show support.
Okay, now what do I get if I'm best dressed? Is there men? I mean,
There are prices for men and women.
Okay.
And there's a lot of giveaways.
All right, I know you're very secretive.
I want to tell you, but it's
You're very secretive.
A big and nice.
Okay,
nice
all right. Listen, I got you. I understand. It's very tight-lipped over there at Community HealthNet. I mean, you can't give out all the info on this show, but so I guess if I come out with my little, I don't even own it, but I'm just pretending I did have a little pink workout outfit to get in favor with the judges, being in breast cancer's pink, I'll get a little bit of an edge. Okay, I see. Wink, wink, nod, nod. You don't have to tell me anymore, Leslie. I figured it out. We have absolutely been enjoying this. All jokes aside, once again, give us the registration, of course, starts at 9. Is there any way people can pre-register? Say you can't come and you kind of want to, while it's on their mind right now, here it is Tuesday. I just heard lovely Leslie on the show, and I do want to kind of donate and participate, but I don't know if I'll be able to be there to register. So can they go onto a website now and pre-register?
Definitely.
Go ahead, tell us how.
Our website is www.chn-indiana.org. If they go under the events tab, they will be able to see the breast cancer for 2022.
Yeah.
And on our website, they will be able to see all the options, how they participate, and they can register online. Again, there are a lot of other opportunities to participate.
Now, obviously, and I support this, the donation is $30, but you have said that, you're really not turning anybody away. Any little bit helps. But $30 is kind of the threshold.
Yes, to walk it is $30, but if you don't want to walk but want to support us and make a donation, you can make any amount.
Absolutely. Now, once again, that's 9, registration, and of course 10, the race starts. Now, once again, let's get down to the nitty gritty, and that is Community HealthNet itself. If people are interested, want to find out about the services offered at locations, not only all 7, but locations near them, the website address for that.
It is www.chn-indiana.org, or they can give us a call at 219-880-1190.
Now, what are hours of operation and days that you're open?
It is from Monday through Friday from 8:30 a.m. to 5 p.m. And we have one location that is open on
I
Saturday.
was about to say, wwhich one's the Saturday? Where's Saturday location?
It is the one that we have on Maryville on 6100 Broadway.
Well, nice.
And it is from 8:30 to 12.
Oh, okay, great. Once again, I always enjoy when you drop by. It's kind of fun. I think this is going to be a big event. Each year it kind of gets bigger and bigger. Like I said, I don't mind being annoyed when I get up and the streets are blocked off because it's for a good cause. And I promise I revealed way too much to you today, Leslie, about how I participated in the event. I'm sorry, don't look down on me, don't judge me, but it's just how I move. But I definitely appreciate you coming on and look forward to talking again. You're doing a great job, by the way. I know Dr. Janet's all over the place, but she's got a good person in her stead that represents very well, and you do a great job. Really want to tell you that personally.
Oh, thank you. I really appreciate it. Thank you again for the invitation. And don't forget, everybody, visit our website and register. chn-indiana.org. Come by and join us and support.
Absolutely.
Thank you.
All right, everybody. Of course, that was Miss